Friends, what happens if a patient comes with severe breathlessness, hypotension, and raised jugular venous pressure? His heart sounds are muffled and the blood pressure is falling. But what if the problem is not inside the heart but the fluid surrounding it? Yes, this is the cardiac tamponade. You can see here the heart is swinging. Here the heart is swinging in a pericardial effusion. The fluid accumulated around the heart and the heart is swinging in this fluid, and this is called the pericardial effusion. Due to this pericardial effusion, a clinical condition, that is emergency, which is called cardiac tamponade. Okay, so this is the case of cardiac tamponade we are going to read. So now friend, we have to understand what is pericardial effusion first, then we can understand cardiac tamponade. So if you see a healthy heart, which is here, a healthy heart, the pericardium, you can see here around the inside the pericardium there is no a little much fluid around the heart. Okay, and if the healthy heart is converted into a unhealthy heart, that is the if pericardial effusion occurs, then excess fluid inside the pericardium or in the pericardial sac happens. What happens? Excess fluid accumulation inside the pericardial sac happens. Due to this excess fluid accumulation, this excess fluid causes constricted heart, means it creates a pressure on the chamber of the heart. Thus the cardiac output decreases and cardiac tamponade happens. So you can see here that here a image is given. This is a echocardiography. And you can see here that this is the left ventricle and this is the right ventricle, and here the black color you can see in these both two left and right ventricle means there is the fluid. Which fluid? Now this is the blood, and you can also see here there is a black color in this PE, written as PE. This is the pericardial effusion. This black color indicates that fluid accumulated surrounding the heart chambers, means in the pericardial sac, and this is the region of pericardial effusion. And this pericardial effusion, the fluid inside this pericardial sac creating the pressure on the heart chambers mainly, and thus the cardiac tamponade happens. You can also see that here is the left ventricle and this is the pericardial effusion. This is the wall of the heart and this is the pericardial effusion. Here the fluid accumulated and creating pressure on the heart chamber, thus causing the cardiac tamponade or cardiac output decreased. So what is the cardiac tamponade? Now you can see here the note. The cardiac tamponade is a form of acute heart failure. This is an acute condition, and this is a heart failure that the body is not getting much oxygen or much blood by the compression of the heart. Who compressing the heart? Actually the pericardial effusion is compressing here the heart. The fluid inside the pericardial sac is compressing the heart. Because the heart is constrained by the external pressure of this fluid, cardiac feeling is severely restricted, means the blood filling of the heart chamber is decreased. If the blood volume inside a heart chamber decreased, then the cardiac output also decreased, and this is the cardiac tamponade. What happens now? Due to pericardial effusion, compression of the heart chamber happens, and the compression of the heart chambers means cardiac filling decrease, and cardiac filling decreased means cardiac output also decreased. So what are the causes and triggers of the cardiac tamponade? Here are 4 points that causes the cardiac tamponade. One is the pericarditis, another is the malignant disease like cancer, Number 3 is myocardial infarction. 4 is trauma or iatrogenic injury. What is pericarditis? Inflammation of the pericardium. Any disease like tuberculosis here, tuberculosis may disseminate from the lungs to the pericardium and may cause the inflammation of the pericardium. This is called the pericarditis, which can lead to cardiac tamponade. Because the tuberculosis disease causes the pericarditis and makes the pericardium so weak that the capillaries from the capillaries the blood are ejected into the blood are drawn into the pericardial sac, and thus the pericardial effusion happens and cardiac tamponade happens. So what is the malignant disease? Cancer also causes the fluid accumulation in the pericardial space, thus causing cardiac tamponade. Another is the myocardial infarction. When the cardiac tamponade happens in myocardial infarction happens when there is a heart attack. If there is heart attack, means the heart muscle are not getting enough blood, enough oxygen to function. Thus the myocardial wall, free wall of the myocardial then ruptures, and there is the pericardial effusion inside the pericardial sac due to the free wall rupture of the myocardium, and the cardiac tamponade happens. So we can see here the pericarditis, malignant disease, myocardial infarction, and another is the trauma. Any trauma causing pericardial space falling, blood is filled inside the pericardial space following the chest trauma. Okay, or as a rare complication of procedure, there are many surgical procedures which may precipitate the cardiac tamponade following an pericardial effusion, like temporary pacemaker insertion. Any error or any wrongness in this procedure may precipitate the pericardial effusion and thus cardiac tamponade. And another cause is the catheter ablation. These are the iatrogenic injury. So we have now the causes are 4, that is the pericarditis, malignant disease, myocardial infarction, and trauma or iatrogenic injury. And we have the clinical features. Number 2 point, what are the signs and symptoms? How can you find the this is a case of cardiac tamponade. There are clinical triads called the big triads, that is the jugular venous pressure increase, that is a raised jugular venous pressure, hypotension, and muffled heart sound. When you hear the heart sound using a stethoscope, there you can then you can hear that the heart sounds are muffled, so the loudness is decreased in the heart sound, and also along with the first and second heart sound you can also hear a third heart sound, and this is the you can assure that this is a case of the cardiac tamponade. So what is it? It is saying that severe hypotension is occur, and then we have the elevated jugular venous pressure, and here you can see that muffled heart sound. These 3 are the classical triad of cardiac tamponade. And another signs and symptoms are dyspnea. You have the breathing difficulties in while breathing, and you can have the oliguria, less urine production and urine output due to poor perfusion to the tissue of the kidney. And you can have a question why the elevated jugular venous pressure happens. The jugular venous pressure increases because of the back pressure from the right atrium. As the pericardial effusion, the fluid accumulated in the pericardial sac causing pressure to the heart chamber. So during the contraction systole of the atrium or ventricle, right ventricle or right atrium, during the systole of the right atrium mainly, it causes some little amount of the blood that enters in the jugular vein also. So this elevates the jugular venous pressure. So this is a actually this is a back pressure. So we have the pulsus paradoxus. What is pulsus paradoxus? Now fall in blood pressure, as actually severe hypotension happens, so blood pressure decreases here because the cardiac output decreases. Blood filling inside the heart chamber also decreases, cardiac output decreases, so severe hypotension occurs and blood pressure decreases. more than 10 mmHg. This is called the pulsus paradoxus. During mainly inspiration, where the pulse may become entirely impalpable. Auscultation of findings. Soft or muffled heart sounds with an early third heart sounds is present. Along with S1 and S2, you can have a S3 in cardiac tamponade. Okay, and the heart sound you will hear with a stethoscope will be muffled or soft heart sound due to the fluid accumulated in the pericardial sac. You will have a muffled heart sound. Investigation and diagnosis: echocardiography, ECG and chest X-ray. You will have to do echocardiography for the visualization of the pericardial effusion and the chamber compression, and then you have to do ECG. The abnormality of ECG is here that small QRS complex in the cardiac tamponade, and you can have the electrical alternance means swinging of the heart within the fluid. Chest X-ray. Chest X-ray may show that rounded, enlarged or globular shaped heart. Okay, so the management, what can be the management? The percutaneous pericardiocentesis using an echocardiographic guidance. The aspiration of the fluid inside the pericardial sac using a needle under the echocardiographic guidance. So this is the pericardiocentesis. And another is the surgical drainage. Surgical drainage means surgical drainage of when it needed the surgical drainage for loculated means a local effusion, a small area. The pericardial effusion happens in a small locule or a area, then we can see this is a loculated effusion, and during this you need the surgical drainage. Important exceptions is there, like the heart muscle rupture or aortic dissections. During these two conditions, aortic dissection and a heart muscle rupture, needle aspiration can precipitate further fatal bleeding. Means the percutaneous pericardiocentesis is not, we should not done the pericardiocentesis in the case of heart muscle rupture or aortic dissection. We should go through the emergency surgery.